Okay, let's dive right into something I bet many of you listening have wrestled with. You know that feeling when you step into the gym and someone inevitably asks, "So what do you bench?"
Oh, yeah. That's the question.
It's the lift, right? The
Hmm.
one everyone seems to care about, maybe even the one you care about most. But for a lot of people, myself included sometimes, it's also a major source of, well, frustration.
That's absolutely right. And it's not just you feeling that way. Our source material for this deep dive actually highlighted this surprisingly well.
Mm,
They did a survey, and guess what?
what'd they find?
Almost two-thirds of the respondents found the bench press their single biggest source of frustration.
Two-thirds. Wow.
Yeah, that's a huge number and really validates that if you're struggling with it, you're definitely not alone.
Exactly. So our mission today is to take the source material shared by our listener, this really comprehensive guide that covers like everything from physics to troubleshooting, and break it down.
Yeah, dig into it.
We want to explore the science behind why things happen in the bench press, understand why certain technique cues work or, don't work, and hopefully give you those aha moments and practical insights that can help you break through frustration and build a bigger, stronger bench.
And we've got a great stack of information here to work with. The source starts with the foundational stuff, the basic physics and anatomy that underlies everything.
A bedrock.
Exactly. Then it moves into the practical side, covering the basic setup and execution, the actual how-to. After that, we get into the deeper biomechanics, looking at why different techniques have the effects they do.
Okay.
And finally, there's a really helpful section dedicated to common questions, troubleshooting issues you might face, and variations you can use.
Perfect.
Hmm.
Let's start with that bedrock then. Section 1, the physics and anatomy. Now look, you don't need a degree in either of these subjects to bench, but understanding a little of the background really helps explain why technique matters so much later on.
Precisely. The source introduces two key physics terms that are helpful. First, force. This is pretty straightforward. It's linear, like a push or pull in a straight line.
Like gravity pulling the bar down.
Exactly. Think about the barbell itself. If you have a 150-kilogram bar, gravity is exerting a force of about 1470 newtons straight downward on it. When your muscles contract, they're also exerting linear force to counteract that.
Got it. Straight line, push or pull. What's the second term?
That's moment. And this is where things get a little more interesting for movement around joints. Moment is rotational force, or torque.
Torque, okay.
It's calculated as the force multiplied by the perpendicular distance from an axis, like a joint. The source uses the example of a bicep curl. A 20-kilogram bar with a 30-centimeter forearm creates about a 58.8 newton-meter extensor moment at the elbow.
Okay.
This distance from the axis, perpendicular to the force, is called the moment arm.
Okay, so moment is like trying to open a heavy door. If you push right next to the hinge,
Oh.
the axis.
It's really hard, right?
Yeah, very hard. But if you push way out on the edge of the door, a longer moment arm, it's much easier to create that rotational force to open it, even with less linear push.
Exactly. That's a perfect analogy. You have external moments from the load, the bar, trying to rotate your joints in one direction, and internal moments from your muscles pulling on your bones, which act like levers around your joints, trying to rotate them the other way.
Yeah.
Your muscles have to produce a larger internal moment to overcome the external one from the bar.
So in the bench press, you're using your muscles to produce those internal moments at your joints, primarily your elbows and shoulders,
Right.
that are larger than the external moments the bar is creating. If you can do that, you successfully press the bar.
That's the core idea. The bar creates an external flexor moment at your elbow, trying to bend it back down.
Okay.
An external extensor and horizontal extensor moments at your shoulder, trying to push your arm down and away from your chest.
And the size of that external moment, the one your muscles have to fight, it depends on the load, obviously,
Yeah.
but also the length of that moment.
Exactly. Load and moment arm length.
Hmm.
This is why, as the source points out, people with longer limbs generally have longer moment arms for given weight, making that weight feel harder relative to someone with shorter limbs because the muscle needs to produce a larger moment to lift it.
Okay, so limb length matters because it affects the moment arms, the leverage. And what determines if your muscles can overcome those moments? What makes the internal moment bigger?
Well, the source lists two factors: muscle attachment points and contractile force. Attachment points are crucial because muscles often attach very close to joints, giving them kind of poor leverage initially. So even tiny differences in where a muscle attaches can have huge effects.
But you can't change those.
Yeah, you're born with those.
Yeah.
The only thing you can control is increasing your muscle's contractile force. And you do that in two ways: increasing your skill with the lift so your current muscle mass is more effectively coordinated,
Mm-hmm. Technique.
and by adding more muscle mass, getting stronger.
Skill and muscle mass. Simple enough takeaway from the physics and leverage side of things. Now, the anatomy snapshot. What are the key players we need to know about? The bones and stuff.
Yeah, the source highlights several bones and joints vital for the bench. Your scapulae, or shoulder blades, are essential for the setup. Retracting them is key. We'll get back to that.
Okay.
The clavicle, or collarbone, is an attachment point for the upper pecs. The humerus, your upper arm bone, connects your shoulder and elbow and is where major muscles like the pecs, lats, and triceps attach.
And the forearm bones that connect to the elbow, the ulna.
Yes, the ulna on your pinky side is particularly important as the major attachment point for your triceps at the elbow's knobby part, the olecranon process. That's crucial for elbow extension, straightening your arm.
Got it. What about the joints themselves, where the movement happens?
The shoulder complex is a shallow, mobile ball and socket joint. It offers great range of motion, but inherently has less stability compared to, say, the hip joint.
More mobile, less stable. Makes sense.
Right. The primary movements happening here during the bench are shoulder flexion, raising the arm forward, and horizontal flexion, bringing the arm across the body. We also need to consider abduction, how tucked your elbows are relative to your torso, and internal-external rotation.
Okay.
The elbow is a simpler hinge joint, primarily performing extension in the bench, just bending and straightening.
Pretty straightforward.
And the wrist requires some radial deviation, a bit of sideways bend for wider grips, and issues with excessive cocking back can lead to problems.
Yeah, we'll touch on that later, I bet. And the muscles, the ones doing the lion's share of the work.
Right, the prime movers. The source lists the pecs, pectoralis major and minor, as the biggest, strongest prime mover, mainly for horizontal flexion, but assisting with shoulder flexion. They originate on the clavicle and sternum rib cage and insert on the humerus.
The chest muscles.
Yep. The triceps brachii are the sole elbow extensors, straightening the arm, with 3 heads inserting on the ulna. And the anterior deltoids, the front part of your shoulder muscle, are the primary shoulder flexors, helping raise the arm. They originate on the clavicle and insert on the humerus.
Pecs, triceps, front delts. The big 3 for bench.
Pretty much. The source also mentions the rotator cuff for shoulder stability and the lats, latissimus dorsi, which play a complex role that this specific guide doesn't detail extensively, but they're definitely involved in stabilizing and controlling the movement.
Okay, so combining the physics, the forces and moments, and the anatomy, the bones, joints, and muscles, what are the 3 major movements combining all these elements that we're producing to actually lift the bar?
As the source summarizes, shoulder flexion, horizontal flexion, and elbow extension.
Okay.
Grip width mainly impacts horizontal flexion. Demands a wider grip, means a greater demand on your pecs.
Makes sense.
Elbow extension demands are a bit trickier,
Mm.
related to elbow position and grip width, which we'll definitely delve into more in Section 3 because it's not as straightforward as it might seem.
Right. Tease that complexity for later. Okay, laying the groundwork is done. Now for Section 2. How to bench the basics in practice. This is where we take that theory and apply it to the actual setup and execution under the bar.
Exactly. The source breaks down the lift, step by step first, setup.
Equipment check first. Always smart. Anything specific the source mentions there?
Yes, 2 key things. A grippy bench, maybe throw yoga mat down if it's slick to prevent sliding,
Good hack.
and setting the hooks correctly. You should be able to comfortably clear the hooks by an inch or 2 without having to press it up or lose your setup, but you also don't want to reach way back for it either, finding that sweet spot.
Then getting those shoulder blades in position, scapular retraction, pulling them back.
Retraction is the key here, actively pulling your shoulder blades together like you're trying to pinch a pencil between them. The source explains why this is so important. It pushes your chest up, which immediately reduces the distance the bar has to travel. The range of motion.
Shorter distance, easier lift, potentially.
Right. And it locks your shoulders into a more stable and safer position, reducing injury risk. You can also experiment with depressing or elevating your scapulae slightly, along with the retraction for your own comfort and leverage. Find what feels solid for you.
And the arch. Getting tight and arching. This seems like a contentious topic for some people. Is it necessary?
It can be, yeah. But the source recommends at least a modest arch for most people because, again, it further reduces range of motion and puts the bottom position in a safer spot for the shoulders.
So efficiency and safety again.
Exactly. It describes 2 techniques for getting into the arch and driving the chest up. One starts by setting the shoulders and pushing the hips back, and the other starts by setting the hips and pushing the shoulders back. Experiment there too.
But the key is chest up.
Crucially, the source emphasizes driving the chest up towards the ceiling, not just cranking your lower back. Raising the chest is where the main technical benefit of the arch comes from.
Got it.
And this is important. Before unracking, take a big, deep breath into your stomach like you would for a heavy squat or deadlift. Brace that core.
Why is that so important for bench?
This creates intra-abdominal pressure and torso rigidity, which is vital for stability and transferring leg drive force.
Ah, the deep breath helps transfer that leg drive. Speaking of which, foot position. Where do your feet go?
Right. Your feet are your anchors for stability and enable that leg drive we just mentioned. The source describes 3 basic positions. Feet out in front, kind of relaxed.
Like just sitting on the bench normally?
Yeah. Then feet pulled way back, closer to the bench under your hips, and feet back and out to the side, sort of a combination.
Which is best?
Well, the back and out position is the most common, especially in powerlifting, because it generally allows for a good arch, makes it easier to keep your whole foot down if needed for competition rules, and is generally most effective for generating significant leg drive.
Okay, makes sense. So setup is locked in, feeling tight, time for unracking.
First, the grip. Outside shoulder width is standard, with 1.5 to 2 times shoulder width being common and strongest for most people. In powerlifting, the widest legal grip is with your pointer fingers on the rings of the bar.
And how hard should you grip it?
Then, the source gives a great, slightly crude cue. Squeeze the ever-loving shit out of the bar.
Uh-huh. Okay, squeeze it hard. Why?
It helps. Maybe through muscle irradiation, squeezing hard activates surrounding muscles.
Yeah.
Or just better control and mind-muscle connection. Makes the bar feel lighter, more controlled.
Spotters. Self-unrack. Any tips there from the source?
If you have a spotter, tell them exactly how you want the handoff. Help gently lift it. Don't just jerk the bar up for you. Clear communication. If you self-unrack, which is common, you often need to set up a little further back on the bench with the bar starting over your nose or mouth instead of your forehead, so you don't lose your arch or scapular position reaching back for it.
Ah, subtle adjustment.
Yeah, and make sure the safeties or pins in the rack are set low enough to unrack without compromising your tight position.
And wrist position. I see people with wrists totally bent back sometimes, which looks painful.
Yeah, that's not ideal. The source strongly advises against excessive wrist cocking back or hyperextension. You want to sit the bar lower in your hand, closer to the base of your palm, so the force goes more directly through your forearm bones, like you're punching the ceiling.
How do you maintain that?
Squeezing the bar hard helps by activating your wrist flexors. Wrist wraps are a good option if you still have issues, providing external support.
Oh, okay.
The source also mentions that some people find a slight diagonal grip, sort of across the palm, can help alleviate medial elbow pain on the inside of the elbow.
Good practical tips. Now, the descent. Getting the bar down to your chest. Control is key here, I assume.
Absolutely. Lower the bar under control. The source suggests aiming for around 2,003 seconds. Elite lifters often lower slower and with better control, which helps with the eccentric phase and maintaining tension and stability. Don't just drop it.
Cues for the descent, like rip the bar in half. I hear that one a lot.
Yes. The source mentions these are common cues that many people find helpful. Mentally trying to rip the bar in half or bend the bar by screwing your hands outwards against the bar can help activate the upper back and lats,
Okay.
which contributes to control and stability on the way down. Keeps everything tight.
And the touch point. Where on the chest should the bar land? High? Low?
Crucially, the source says touch the bar fairly low on your chest. The area from nipple line down to the bottom of the sternum is usually the strongest and most comfortable for most people.
So not up by the collarbones.
Definitely not. It might be slightly lower with a very big arch or a close grip, but you generally don't want to touch higher than your nipples.
How do you find your spot?
You need to experiment a little to find your own strongest spot and then be consistent with it. The chalk mark technique, putting a little chalk on the bar and seeing where it lands on your shirt, is a good way to check consistency rep after rep. The source also adds a note that very jacked lifters with big lats and triceps might use a lot of elbow tuck to kind of compress those muscles and cushion the bar's descent, almost resting it on their arm slats.
Ah, using their own muscle mass.
Yeah, but for most people, just focusing on touching low on the chest will naturally lead to an appropriate elbow tuck.
Next up is pausing, which is key for powerlifting competition, but also a great training tool, right?
Yes, pausing on the chest is required in powerlifting rules, but it's also excellent for building strength right off the chest, killing that stretch reflex. The source describes 2 main styles.
Okay, what are they?
The soft pause is most common. You lower the bar under control, Actively drive your chest up to meet the bar for just a moment of rest while maintaining full body tension, and then drive up after the pause. Stillness, but active tension.
And the less common sinking technique sounds a bit different.
It is. This is less common and definitely not recommended for new lifters. Used by some elite benchers like Jeremy Hornstra.
I've heard that name.
Yeah, he's known for it. It involves letting the bar sink slightly into the chest tissue, maybe collapsing the arch just a tiny bit, and then aggressively re-extending the spine and driving the chest up to meet the bar with momentum, almost like using a quick rebound off the sink.
Sounds risky.
The source cautions it's much harder to master and notes that competition rules often prohibit heaving or pressing after the pause command, which is subtly different from the sink and drive technique on the pause itself. Stick with the soft pause unless you really know what you're doing.
Good advice. Okay, pause is done. The essence. Getting the bar from your chest back up to lockout. How should that feel?
Drive the bar off your chest aggressively. You initiate this with that powerful leg drive you built up in the setup.
Use the legs.
Yes, you want to push the bar up and back towards your face, not straight up.
Up and back. Why back?
We'll get into the biomechanics of that in the next section, but it's much more efficient.
Yeah.
Initially, your elbows will likely be quite tucked from the low touch point. As you drive up, start smoothly flaring your elbows outwards to bring the bar back over your upper chest throat area.
So tuck on the way down, flare on the way up.
Generally, yes, but it should be smooth, not jerky. This bar path is much more efficient biomechanically if it feels comfortable for your shoulders. Don't force the flare if it causes shoulder pain. Find the path that works for you, but aim for that up and back motion.
What about breathing during the rep? Holding it.
Hold that deep breath you took during the setup throughout the entire repetition, from unrack to lockout.
The whole time.
Yes, this helps maintain torso rigidity and stability. It's like bracing for a heavy lift. Release the breath near lockout or after the rep is complete.
An effort on every single rep. The source mentioned something about pressing hard and fast.
Yes, this is an important point from the source. It emphasizes pressing every rep, even warm-ups, as hard and fast as possible while maintaining good form.
Why fast?
It mentions a study finding that pressing faster resulted in almost twice the gains in strength and muscle compared to slower pressing, even with the same weight. The explanation is that pressing harder with more intent leads to higher force output and recruits more high-threshold motor units, enhancing the training effect. Maximize intent on every rep.
That's a great overview of the basics. So that covers the how, the step-by-step setup and execution. But to truly master the bench, we need to understand the why behind all those cues and positions.
Exactly.
And that brings us to the deep dive into the biomechanics in Section 3. Here's where it gets really interesting, trying to understand the forces at play.
Exactly. We've discussed the three main movements involved in the bench: horizontal flexion, shoulder flexion, and elbow extension. Let's look at how technique choices affect the demands on your muscles through the range of motion.
Okay, horizontal flexion first. Bringing the arm across the body. The source said grip width dictates the demands here.
Right. Horizontal flexion is bringing your upper arm across your body towards the midline. A wider grip means your hands are further out laterally from your shoulders, so the horizontal flexion moment arm is longer.
Longer lever.
Yep. This means horizontal flexion demands are higher, which mainly challenges your pecs. The source notes that bar path doesn't really change horizontal flexion demands. They're pretty much constant throughout the lift based on your fixed grip width.
Okay, so wider grip, more pec demands. Simple enough. What about shoulder flexion? That was more dynamic, you said. Depends on how far the bar is in front of your shoulder from the side view.
Correct. Shoulder flexion is raising your upper arm forward. Demands here are highest when the bar is furthest in front of your shoulder, which is typically when the bar is on your chest.
Makes sense.
And demands are negligible at lockout when the bar is directly over your shoulder joint. This is where bar path becomes crucial, driving the bar up and back off your chest rather than straight up.
Like we just talked about in the ascent.
Exactly. That reduces the distance it's in front of your shoulder through the initial portion of the lift. This significantly decreases shoulder flexion demands and makes the lift easier on your front deltoids.
So when the source references visuals showing novice lifters often drive straight up initially, while elite lifters drive up and back, that up and back path is fundamentally making the lift easier on the front delts at the bottom. Is that the main benefit?
That's a huge part of it, yes. And it positions the bar better biomechanically for the rest of the press. It's tricky to explain without seeing the diagrams the source references, but essentially, imagine the bar moving up and toward your head instead of just straight up from your chest. Less forward lever arm for the shoulder flexors to deal with early on.
And that's where leg drive comes in, isn't it? It helps achieve that up and back bar path. It's not just arm movement.
Yes, the source explains how leg drive, initiated by squeezing your glutes and driving your heels into the floor, or back into the bench depending on your setup, helps push your chest back into the bar. This force pushes your torso relative to the bar, effectively helping you achieve that desired up and back bar path without just using your arms to pull it back. It assists the whole system.
Okay, that clicks. Leg drive helps the path. Now, the tricky part you teased earlier, elbow extension. The source had that finding that a wide grip theoretically imposes an elbow extensor moment, which seems counterintuitive because your elbows bend under weight, right? They don't straighten themselves.
It did seem weird at first glance. The source explains that theoretically, if your hands are outside your elbows, the force of the bar pulling straight down could create a moment trying to straighten your elbows.
Yeah.
But obviously, the bar doesn't just extend your elbows when you're benching heavyweight. The explanation involves something called lateral forces.
Lateral forces, like pushing outwards,
Yeah,
sideways.
Exactly. Pushing outwards. The source uses a great analogy with dumbbells. With dumbbells, you primarily apply force straight up because you can't apply much force sideways without the weights wobbling or dropping, right?
Yeah, they just fall outwards.
Right. This requires your hands to stay roughly over your elbows through the movement, leading to that arcing bar path you see in DB pressing. But with a barbell, because your hands are fixed on the bar, your triceps can exert significant lateral force. The source estimates maybe 25–30% of the vertical force as they try to push your forearms and hands outwards against the bar's fixed width.
Okay, I'm going to stop you there because the lateral force thing, combined with theoretical moments, my brain is starting to hurt a little. Can we break that down even slower? So my triceps are pushing outwards, like trying to spread the bar apart?
Sort of, yeah. Because your hands are fixed on the bar, when your triceps contract powerfully to extend the elbow, they also try to push outwards, creating these lateral forces against the bar. Now, think back to our moment discussion.
Okay, moment, first times distance.
Right. The external moment the bar creates at your shoulder is based on the downward force of gravity and the horizontal distance from your shoulder joint to the bar. But when you combine the downward force of gravity with those outward lateral forces from your triceps, the resultant force vector, the direction the total force is acting, isn't straight down anymore.
Okay, resultant force vector. It's diagonal now, down and out.
Exactly. Imagine that diagonal arrow pointing down and slightly outwards that the source diagram likely shows. That diagonal force line actually passes much closer to your shoulder joint than if the force was just pulling straight down.
Closer to the joint.
And because that diagonal line is closer to your shoulder joint, it significantly shortens the horizontal flexion moment arm at the shoulder.
Ah, shorter moment arm. As we discussed earlier, that makes the lift easier.
Precisely. Easier for your pecs, the primary horizontal flexors.
Wow. So my triceps aren't just helping to straighten my elbows. By pushing outwards against the fixed bar width, they are actively changing the physics to make the lift easier in my chest. That feels backwards. But cool?
It does, doesn't it? But that's what the source's biomechanics explanation suggests. It highlights the synergy. Pecs and triceps work together because the hands are fixed on the bar. Pecs help elbow extension, and triceps help horizontal flexion by creating those lateral forces and shortening that moment arm. They aid each other through the lift in complex ways.
That totally changes how I think about the bench press. Okay, back to elbow extension demands. When are they highest? Is it still harder on the triceps with a close grip?
Yes. Typically higher with a closer grip because your elbows are usually outside your hands, creating a consistent elbow flexion moment that your triceps have to fight directly. With a wide grip, your hands are outside your elbows, and while there's that theoretical extensor moment, those lateral forces seem to change the picture significantly throughout the lift, reducing the net flexion moment the triceps face compared to close grip.
Okay, and what about elbow tuck? How much should we tuck? Does tucking help or hurt the triceps?
The source advises aiming for an angle of roughly 45 to 60 degrees between your upper arm and your torso at the bottom. Tucking your elbows under the bar, closer to your torso within that range, generally decreases elbow extension demands because your elbows are closer to being vertically aligned under the bar and your shoulders.
So some tuck is good. What about over tucking, elbows way in front?
Right. The source notes that over tucking, where your elbows wind up significantly in front of the bar relative to your shoulders, actually increases elbow extension demands because now your triceps have to work harder to push the bar back and up, fighting against that forward position.
But you said earlier maybe a slight overtuck could help.
Yes, the source mentions that a slight overtuck, maybe 1–2 inches in front of the bar at the bottom, can be helpful for some people to initiate that initial up and back drive off the chest, allowing the triceps to assist the shoulders in starting that backward movement. But generally, you want your elbows to track under the bar as you press, getting them more outwards, flaring by the mid-range and lockout. You don't want to stay heavily overtucked through the whole lift.
Got it. Keep them mostly under the bar. Where do elbow extension demands typically peak during the lift then? Where's the hardest part for the triceps?
The source says they typically peak when your upper arms are roughly parallel to the floor, referencing a diagram of the elbow path through the lift. This is often why the sticking point occurs around this position. It's a biomechanically challenging part of the movement for elbow extension.
That makes so much sense. Mid-range sticking point often feels like the triceps giving out. Okay, we've covered the mechanics and the why behind them. Now, section 4, diagnosing weaknesses and fixing them. How do we apply this knowledge to figure out why a lift might fail and what specific exercises or tweaks can help?
Right, because failure isn't always simple. The source explains that failure isn't always as simple as happening exactly where the summed joint moments are theoretically highest, like right on the chest. Other factors like the muscle length tension relationship.
Muscles being stronger at certain lengths.
Exactly. And changing internal moment arms as joints move, and the stretch reflex, the bounce you get off the chest, are also at play.
The sticking point, as we just mentioned, is usually around 4–6 inches off the chest, where velocity tends to slow down significantly. That's the most common place to fail.
Yes, the source references studies showing this velocity curve. It's the most common sticking point.
Yeah.
So how do we diagnose based on where the miss happens?
First, weakness at the very bottom, pinned. This is that frustrating moment when you get the bar to your chest, try to press, and nothing happens, or you only move it an inch or two, especially on small weight jumps. What could be causing that?
The source lists several potential causes for this. The default assumption, because shoulder flexion demands peak at the bottom, is anterior delt weakness. Your front shoulders just aren't strong enough to start the movement.
Okay, that's the obvious one.
However, it's not the only reason. It could be improper bar path touching too low, where you're trying to cut range of motion too much or hitting a weirdly weak spot. Or maybe pec weakness if you feel weaker touching slightly higher where the range is longer, but might be a stronger position biomechanically for your leverages.
Interesting.
It could also relate to poor setup control support muscle strength if you feel shaky or unstable on the way down. Maybe your lats or upper back aren't tight enough. Finally, triceps weakness can contribute because they aid the pecs and delts. Although the source notes it's hard to pinpoint triceps as the definite primary cause of a miss right off the chest. Could be any of those, or a combo.
Lots of possibilities just for missing at the bottom. Okay, what about the most common miss? Missing through the mid-range. This is after the initial drive, but the bar stalls out somewhere before lockout, usually that 4–6 inch area.
Right, the classic sticking point. The source says there are two main causes here. First, and often simplest to fix, is improper bar path driving straight up instead of up and back towards your face.
Like we discussed, if you drive straight up, you hit that harder shoulder flexion point longer.
Exactly. Correcting that bar path to be more up and back can often help you blow through this sticking point immediately. Second, and most likely if your bar path is good, is simply you just need to get stronger.
Just need to get stronger. That feels like a cop-out answer, but I guess biomechanically it's the hardest spot.
Pretty much. The source calls this area the naturally weakest point. Biomechanically demands are high, the stretch reflex on the chest is gone, and the muscles are moving into a less optimal part of their length tension curve. So if your bar path is solid and you miss here, the source actually calls it a good miss.
A good miss. How is missing good?
Well, good in the sense that it means you likely don't have specific glaring technical or muscular weaknesses holding you back at that point. You're just hitting the natural biomechanical wall. The solution is simply more overall strength in your pecs and triceps. Keep training.
Okay, that's almost reassuring. Like, it's not you, it's physics mostly. And finally, missing at lockout. The bar gets close to the top but just won't finish. What's happening there?
Two main causes here as well, according to the source. First, improper elbow position. As you approach lockout, your elbows should ideally be flaring outwards, maybe facing towards opposite walls, with your shoulders slightly internally rotated. Think screwing your shoulders outwards.
Okay.
If your elbows are still pointing forward, you're not allowing your pecs and triceps to work optimally together to finish the press. The source shows images illustrating this correct versus incorrect position. Fixing this positioning, focusing on that outward flare and screw, often helps immediately.
And the second cause, let me guess.
Again, you just need to get stronger. If your elbow position is correct at lockout but you still miss, the source says some people are just plain weakest biomechanically at this very top-end range and simply need more overall pec and tricep strength to finish.
So technique first, then just overall strength. That seems to be the theme.
It really is. Fix the path and positioning, then build the muscle.
That's a fantastic framework for diagnosing problems based on where the lift fails. It connects the theory to the practical issues people face. Now, on to Section 5. Common questions, issues, and variations. The source had a big FAQ section covering lots of things listeners probably wonder about. Let's hit some key points. First, cueing. The source lists specific cues. Are some better than others?
Yes, the source lists specific cues tied to different parts of the lift that we've already mentioned. Squeeze the shit out of the bar for grip, bend the bar in half for descent control. Chest up, inflate your stomach, heels through the floor, squeeze glutes for leg drive, and flare or screw your shoulders out for the ascent and lockout.
Internal versus external cues, does that matter?
It touches on that briefly, noting that external cues like focusing on the bar or the environment, throw the bar through the ceiling, might be better for performance and bar speed, citing some research. While internal cues, focusing on your body, squeeze your pecs, might be better for muscle activation and potentially hypertrophy, especially on later sets or accessory work. Use the right cue for the goal.
Okay. What about the reverse grip bench press? The source author mentioned being strongest with it. That sounds intriguing.
Yes, the author shares their personal anecdote of benching 475 pounds with a reverse grip, noting it was their strongest variation. The source highlights potential pros.
Like what?
Research showing significantly higher upper pec activation, maybe 25–30% higher, so potentially good for targeting that area. Also, potentially more comfortable for some people with shoulder or elbow issues because the shoulder is in an externally rotated position.
Any other benefits?
It also involves the front delts and biceps more, with research showing like double the biceps activation compared to regular bench. So, good assistance muscle work built in.
Seems great. What are the downsides then? Why isn't everyone doing it?
Well, it can feel less secure with very heavy weight. The grip just isn't as locked in for most people. It's uncomfortable for some due to the required wrist extension, that wrist cocking back we said, to avoid a normal bench or potential stress on the biceps tendon. And, importantly, it is not allowed in most powerlifting competitions.
Okay, so maybe not for competitors. Anything else?
Yes, and this is crucial. The source issues a vital safety warning here that cannot be overstated.
Okay, what is it?
The reverse grip bench requires a competent spotter or a power rack with safety set high enough to catch the bar above your throat.
Above the throat? Why so specific?
Because unlike a standard pronated grip where a dropped bar might land on your rib cage or sternum painful, but usually survivable, dropping the bar with a reverse grip means it's falling directly onto your neck or throat.
Oh, wow. Yeah, that's bad.
Extremely bad. This detail from the source is absolutely critical for anyone considering this variation. Do not try this alone without proper safety measures in place.
Wow, that safety warning is huge. It's easy to just see someone doing it and think, cool variation, but you really need to respect the physics there. Thanks for highlighting that critical point from the source with the emphasis it deserves. Seriously. What about incline and decline press? Are they essential for chest development?
Essential? Probably not. Incline press trains the front delts slightly harder, and maybe the upper pecs, although the source suggests the wide grip reverse bench might be even better for upper pecs based on muscle activation data. If you do incline, it recommends using a relatively low incline, like 15–30 degrees, if you're trying to target pecs. Steeper inclines, 45 degrees or more, shift the emphasis significantly towards the deltoids.
Okay, low incline for pecs. What about decline?
Decline press. The source is pretty blunt, calling it primarily an ego lift.
Ego lift. Why?
Because you can typically lift more weight due to the shorter range of motion. However, it notes that research shows similar or even lower muscle activation compared to flat bench. It can be a substitute if you have shoulder problems that prevent flat benching, but the source argues that dips are actually a better alternative for a similar downward angle and chest emphasis.
Why dips?
Dips allow for free scapular movement and generally offer greater range of motion, potentially better stimulus.
Interesting take. Can you maximize hypertrophy chest and triceps development with just the bench press? Is it enough?
The source says you absolutely can grow your chest and triceps using just the bench press. It's a compound staple for a reason, but you probably can't maximize their development with bench alone.
Why not?
It explains why. Different regions of muscles or individual heads, like the different heads of the triceps, might activate and grow differently with different exercises and angles. Variety is beneficial for overall development, specifically the long head of the triceps, which crosses the shoulder joint.
Right, it attaches up on the shoulder blade too.
Exactly. It isn't fully trained by bench alone compared to exercises with higher shoulder extension demands, like overhead extensions or certain skull crusher pullover variations where the arm goes back further. So bench is great, but add variety for maximum growth.
Okay, let's talk pain management. Shoulder, elbow, wrist, back, hips. This is incredibly common for people benching regularly.
Right.
What does the source suggest?
Yes, the source dedicates a significant portion to this, which is great. First, a very strong disclaimer, repeated from the source. If you have severe or persistent pain, pain that is getting worse, or pain outside the gym, stop reading this section, stop listening to us for a second, and go see a qualified physical therapist or doctor.
Seriously, get professional help for real pain.
Absolutely. This section is for minor irritation while training. A general approach the source advises for minor pain is volume reduction, starting with maybe cutting your sets reps by 70–50% initially and carefully building back up as pain allows. Don't just push through sharp pain.
Okay, makes sense. For shoulder or elbow pain specifically, often felt at the bottom of the lift.
The source suggests that many elbow issues in benching are actually rooted in shoulder limitations or positioning, an interesting diagnostic tool. If reverse grip is pain-free or less painful, it's likely a shoulder issue rather than a primary elbow joint problem because reverse grip changes the shoulder mechanics.
Okay, so what are the suggested fixes?
Ensuring proper scapular retraction is locked in, including plenty of pulling movements. Aim for at least a 1.1 ratio of pulling sets to pressing sets in your program. Training external rotators through their full range of motion, not just side-lying raises. Adding push-ups plus for serratus anterior stability under the scapula, and including incline curls and light flies.
Why incline curls and flies?
Doing sets of 15–20 reps of these can help train and potentially improve stretch tolerance and strength through the full range of motion for the pecs and biceps, which are stressed at the bottom of the bench.
Got it. What about tendinitis, like golfer's elbow, tennis elbow, or pain near the pec or biceps insertion?
The general approach here from the source is rest, followed by carefully implementing eccentric training.
Eccentric, focusing on the lowering part.
Exactly, meaning focusing on lowering the weight under control for 2 to 3 seconds or even more. Machines or a partner can be very helpful for eccentric-only training, where you only lower the weight and they help you lift it back up. This controlled negative seems to help tendon rehab. For biceps insertion pain, which the source notes is common in strong benchers who might neglect to direct biceps work, it suggests adding incline curls back into training once it feels better to strengthen the biceps in that stretched position.
Wrist pain. Quick fixes.
First, check wrist position bar low in hand. Avoid excessive cocking back. Use wrist wraps if issues persist. They definitely help stabilize. If the pain is specifically on the thumb side of the wrist, the source suggests trying a slightly narrower grip.
Back or hips cramping from holding that tight arch. That sounds awful.
It can be. The source is pretty direct here. Suck it up for now is one approach mentioned, acknowledging it just happens sometimes with a very tight competition-style arch.
Seriously, just deal with it.
Well, it also says stretching beforehand helps, and the frequency often decreases over time as your body adapts. For non-competitors not needing a super strict arch, a looser setup can fix it immediately. So, depends on your goals.
Fair enough. How about technical points, like keeping your butt down? Common problem.
Adjust foot position. A wider side stance or pulling feet farther back can help anchor you better. Also, focus your leg drive direction forward and towards your shoulders, not straight up, which tends to lift the hips off the bench. Drive horizontally as much as vertically.
Improving your arch, if you want a bigger, safer arch.
You need more thoracic spinal expansion flexibility in your upper back. The source suggests stretching, like cobra pose or using a foam roller actively on your upper back, and even benching over a foam roller placed lengthwise down the bench for light sets to get used to the position and actively improve flexibility there.
Improving leg drive, making it actually do something.
Practice and timing are key. The source stresses focusing on the purpose of leg drive, pushing your chest back and up into the bar to help achieve the proper bar path, rather than just thinking about pushing your feet through the floor aimlessly. Feel it contribute to the bar movement.
How much should you tuck your elbows? We touched on this, but what's the angle?
The source advises aiming for that 45 to 60-degree angle between your upper arm and torso at the bottom. Tuck enough to touch low on the chest, but not so much that your elbows end up significantly in front of the bar.
So not 90 degrees flared way out, but not pinned to your sides either.
Exactly. A slight overtuck, maybe 1 to 2 inches in front, at the very bottom might help the initial drive back for some, as mentioned earlier, but you should transition to flaring them to get them under the bar by the mid-range and lockout.
What about uneven extension, one arm locking out before the other? Looks weird, feels weak.
The source identifies two types. If one arm locks first consistently, it's often the weaker arm locking out sooner because the stronger arm is still pushing and overcompensating for it.
Huh, counterintuitive.
Yeah. If one arm simply won't lock out fully and lags behind, then that lagging side is the weak side. The fix for both is typically adding single-arm accessory work for the weak side, things like single-arm DB press, flies, or front raises to bring it up to speed.
Address the asymmetry directly. Makes sense. Finally, a quick hit on other bench variations mentioned in the source, just to show the range of tools.
Yeah, the source lists many options to add variety or address specific weaknesses. Different grip widths, close, wide, floor press, limits ROM, good for lockout, feet up bench, removes leg drive, spoto press, pausing just off the chest, builds control,
Right.
pin or board press, working specific ranges of motion, using bands or chains for accommodating resistance, specialty bars, like Swiss bar, cambered bar, paused benching like we discussed, and dumbbell bench press, more stability challenge, freer movement. Lots of tools in the toolbox depending on your needs.
Wow, that's a massive amount of information distilled from the source, covering everything from the tiny muscles involved in the physics right through to technique, troubleshooting common aches and pains, and different ways to train. So, after this deep dive into the biomechanics technique and troubleshooting, what's the ultimate takeaway, the big conclusion from the source material? Where does this all lead?
The source brings it back to a core message at the very end, which I think is really important. Technique is absolutely crucial, especially for novices and intermediates. Nailing down your technique, improving your skill, that allows you to get all the strength possible out of your current muscle mass. You become more efficient.
Okay, skill first.
But ultimately, to build a truly huge bench press, the source concludes, it relies heavily on adding more upper body muscle mass.
They actually put a number on that, didn't they? Connecting muscle size to strength.
Yes, they cite findings that upper body muscle thickness alone explains about 70–75% of the variation in bench press strength among proficient lifters, people who already have decent technique.
70 to 75%. So most of the difference between good benchers comes down to muscle size.
Largely, yes. Body proportions and levers, those things we talked about like limb length, account for the other 25–30%. So while levers play a role, and you should optimize technique for your levers, muscle mass is the dominant factor once technique is reasonable.
So if you have solid technique, you've worked through common troubleshooting, but your bench is stalled, what's the prescription?
The source's practical prescription is simple. Assuming your technique is decent, the most likely way to add significant pounds to your bench is to increase your overall training volume for the upper body, ensure adequate protein intake, and potentially increase your calorie intake to fuel recovery and growth. Basically, build more muscle.
Makes complete sense. It's not just about the fancy cues or complex variations, although they help optimize what you have, but about the foundational strength built through adding more muscle tissue.
Exactly. Skill maximizes your current potential. Muscle increases that potential ceiling. You need both, but eventually, you need more ceiling.
So here's something to leave you with, building on everything we've discussed from the source material today. If your bench press isn't where you want it, are you quick to blame your limb levers or minor technique flaws? Or have you honestly assessed if you've pushed your muscle building potential through consistent hard training and nutrition as far as it can realistically go right now?
A tough question to ask yourself, honestly.
Or maybe, just maybe, armed with the insights from this deep dive, you'll identify that one specific tweak in your setup, your bar path, your elbow flare, or your accessory work that unlocks the next level for you. Go put this knowledge to work.